So good evening and welcome to Dialogues in Housing, Series 1, Housing, Affordable Housing and the Race Factor in Atlanta Housing Production. Thank you all for being here, and I'm LaConia Dean. I am the Director of Communications and Content Strategy at Atlanta Housing, and I will serve as the facilitator for this evening. It is a pleasure to have each of you with us today. And today's presentation serves as an introduction of an all-new discussion series from Atlanta Housing that's aimed at shedding light on the topic of affordable housing, advocating for its importance, and also providing context on affordable housing as a crisis that impacts us all. Today, we will focus on some of the history of affordable housing, current efforts made to address this social challenge, and the future of affordable housing, with a particular focus on American systems and policies that influence racial disparities in housing, which essentially will help to tell a larger story of the housing experience for Blacks in Atlanta, how policy, racism, and other factors may have contributed to current housing outcomes. Our presentation today will also have 3 segments, led by our esteemed panelists, you all, and it will be followed by an open forum style discussion amongst the panelists, and then a wrap up. So now I will take the time to introduce our guests. Akira Drake Rodriguez is an assistant professor at the University of Pennsylvania's Weizmann School in the Department of City and Regional Planning. Dr. Rodriguez's forthcoming manuscript, Diverging Space for Deviance, the Politics of Atlanta's Public Housing, explores how the politics of public housing planning and race in Atlanta created a politics of resistance within its public housing developments. So this research offers the alternative benefits of public housing outside of shelter provision to challenge the overwhelming narrative of public housing as a dysfunctional relic of the welfare state. And she received her PhD from the Edward J. Blaustein School of Urban Planning and Public Policy at Rutgers University. She has an MPA from the Fels Institute at the University of Pennsylvania and a BS in economics from the Wharton School at the University of Pennsylvania. Welcome, welcome, Akira. Next, we have Atlanta Housing's very own Trish O'Connell. As the Deputy Chief Real Estate Officer for Planning and Development within the Real Estate Division at Atlanta Housing, Trish is responsible for acquisitions and new development of AH vacant land and through partnerships with private development through co-investment and co-development arrangements. The current portfolio includes planning on 200 acres of vacant land with about 116 million of Atlanta housing investment, as well as co-development and those co-investments with private developers. And as a champion for housing affordability in the city of Atlanta, she represents Atlanta Housing on a number of affordable housing and community development task forces and currently serves as the board member of the Community Land Trust. She holds a degree in architecture from UNC Charlotte and an MBA from Emory University, as well as completing the 2-year Yale HUD Community Revitalization Fellowship Program. Trish, we are happy to have you here today. Thank you for being here. And last but certainly not least, we have Courtney Anderson. And Courtney is an assistant professor of law in the Georgia State University College of Law. She is an affiliate member of the Center for Access to Justice and a member of the Center for Law, Health, and Society. She teaches classes in law and social welfare and property. Her research focuses on preserving affordable housing and eradicating the disparities in low-income and minority communities that worsen health issues. Part of the university's Second Century Initiative, she is especially interested in initiatives that pair community and economic development mechanisms with laws and policies to achieve health equity. She earned an LLM with distinction from Georgetown University Law, her JD from Harvard Law, and a Bachelor of Arts summa cum laude from the University of Pittsburgh. So again, welcome to all of you. We really appreciate you being here. We have a really interesting evening planned. We are going to start with Akira, who is going to talk a bit about we're going to go back in history basically, and she's going to talk about the history of affordable housing and some of the race factor, et cetera. And then we will move to segment 2, which Trish will facilitate, which is exploring the evolution of public housing, including Atlanta Housing's approach and efforts to closing the gap in the equitable and inclusive housing for all. And then finally, in segment 3, Courtney will wrap things up. And in her segment, she will be exploring what inclusive, affordable housing and future policies and laws might look like for the future. Okay? So now that we have that outline, we are going to hop right in, starting off with segment 1. Akira, you have the floor.
Thank you so much. So I wanted to talk a little bit about the history of race and housing, as well as social justice in the city of Atlanta, but also how that connects to the broader US story. The first thing I wanted to show is that city planning, for example, has a very strong influence on where people live and what the race is and the value of that land where people live on. And Atlanta lacked a formal city planning authority for quite some time after its founding. What we see here is one of the first attempts to plan for the city, and this includes planning both for the type of land that was going to be used, so commercial and residential, but also talks about the height and the race of the occupants. And so the height of the buildings and the race of the occupants for that matter. And so we see that urban planning started in the city of Atlanta and as well as in other cities as a sort of exercise in racial planning. And so we see the attempt of the city to segregate land use both as a racial issue and as a land use issue. The Atlanta Housing Authority came to be in the year 1938, but before that, we of course had public housing through the New Deal. And so Atlanta is the site of one of the first public housing developments in the country, Techwood Homes, as well as one of the first African-American developments in the country with University Homes. One of the things that enabled the Housing Authority to provide housing for Blacks and whites was that it was a federal program at the start. Atlanta faced a lot of local barriers to accessing housing, and much of that was through the ballot. And so while Black Americans were enfranchised, with the sort of 13th, 14th, and 15th Amendments, you do see, of course, local and state restrictions such as the white Democratic primary for the state of Georgia and many other states as limiting the ability for Black people to participate in this sort of electoral right. And so the inability to impact city decision-making is why you get to see something like a racial zoning plan in the previous slide occur. And so the white primary occurred through 1946 in the city of Atlanta, but prior to that, we had public housing that was designed and implemented and administered and managed by Black Americans and Black Atlantans. And that provided them with a little bit of political opportunity. There are some differences in Black and white public housing. And so we see here pamphlets from the Atlanta Housing Authority's archives that show on the left-hand side the John Hope Homes catalogs for public housing. We see here the amenities are largely the same as the one on the right, the Clark Howell homes for white families. There are some differences in income, mainly that Black incomes are lower, which reflect the artificially low wages of Black work and Black workers at the time. So there is some consideration that not everyone can access housing equally. And so this was an affirmation of local conditions and knowledge and was using the public housing program to equitably serve as many people as possible. At the same time, the failure to have a strong city representation means that a lot of the neighborhood amenities between these two public housing developments were quite different. And so the ability to have good local schools, a healthy parks and library system, and other public services and amenities was something that was negotiated at the local level, and usually where Black public housing residents in particular suffered relative to whites. But we do see here that there were multiple forms of mobility that came out of public housing. On the right is another photo from the Atlanta Housing Archives. This is Albert Marone, who was the head of he was the manager for University Homes, again, the first public housing development for African Americans in the city of Atlanta, and his staff. This staff was trained largely at the Atlanta School of Social Work, which started a program for housing managers in the wake of the New Deal in the 1940s. We see here the construction of John Hope Homes on the left. This construction, many of the jobs went to Black laborers, as well as, again, the management of those homes was allotted to Black social workers and Black housing managers. And so in addition to the actual housing that was provided for a more affluent Black renter, you also see these jobs produced at the local level, allowing for some patronage from the New Deal to accumulate in the Black community. However, in spite of the primary being eliminated after the Georgia Supreme Court ruled it unconstitutional in 1945, and we see that racial zoning still existed, even though at the national level, the US Supreme Court has sort of ruled it also as unconstitutional in 1917. And so we see, even though these sort of racial covenants and racial restrictions were deemed illegal and unconstitutional, they were still practiced quite heavily at the local level. We also see, again, a lot of not just social justice and racial justice, but also this idea of political justice and autonomy coming out of public housing developments. In the upper left-hand corner, the black and white photo shows the Black kitchen cabinet that came to be. That's Mary McLeod Bethune in the middle. These are people who worked with FDR in the kitchen, the Black kitchen cabinet, as they called it, that afforded a lot of Black benefits and privileges to Black tenants, Black workers, and other beneficiaries of the New Deal policies that were notoriously racist against Black workers and Black women in particular. We see, again, this idea that university homes and the initial public housing and public housing generally provided a lot of mobility in spite of a very racialized and restricted land market. And so even though private housing was really difficult to obtain, looking at the survey that I've looked at of university homes residents who lived in the development from 1930 through 1975, an overwhelming, nearly a quarter of them left public housing for private housing. And so there was a great deal of mobility in spite of those local restrictions. And so this photo on the right is William Hartsfield in the middle with, I think that's J.R. Henderson on the left. And on the right, another manager from University Homes showing some of the private homes that their residents have moved into. Once public housing also began getting more mobile participants in the elimination of the white primary, we see the appointment of Black police officers. Again, this is more so in addition, a way of addressing claims of earlier public housing residents who did not feel safe in their communities with white officers patrolling them. And so the ability to make claims on local public goods and services, including police officers, was a very important part of early public housing. There was a lot of mobilization in the tenant associations by Black women who fought for better housing conditions with rent strikes, as well as by connecting these local conditions to larger national efforts. So you see a lot of collaboration with the National Welfare Rights Organization, for example. Here we have on the right Ethel May Matthews, who fought a number of battles with Atlanta housing, both for and against, as well as on the left, Mary Sanford, who was a longtime president of the Perry Homes Tenant Association, testifying at a MARTA hearing in an effort to expand the MARTA line from the downtown to the northwest, where so many of the African-American workforce lived at. And so in conclusion, I just want to sort of say that public housing overall has a very sort of racialized history, but also a history that's full of political opportunity and activism. Thank you.
Thank you so much for that, Akira. This is very, very interesting information. Trish, Akira has already set the stage, kind of painting that important picture of history for us of affordable housing and how that race factor has influenced the practices and policies and how that has impacted the availability of affordable housing in America and, of course, in Atlanta. Let's move now into your segment where we are going to specifically explore the evolution of public housing, including Atlanta Housing's approach and efforts to close the gap in equitable and inclusive housing for all. So can you take us into the current, into the now?
I want to thank you so much for including me in this panel and this discussion. So Akira alluded to the Techwood homes, which was actually developed for a white population. You could even call it white privilege, that early public housing had a swimming pool. And there are actually pictures of people, in their bathing suits swimming. Yeah, and it was really designed to help families who were coming in from the rural areas to find housing. There was a huge housing shortage after the various wars. And so Atlanta has really been a story and a progression in how to deal with affordable housing. And the Atlanta Housing Authority has always been on the forefront of sort of thinking that through. So you have the federal bonds that were made available to create public housing so that there were really no land costs for the units, and the tenants actually paid rent. They worked and they paid rent, and it was really for the working poor. And as Akira also talked about, University Homes and Dr. John Hope saw the opportunity to take advantage of these bonds and was able to really redevelop the West Side. But Atlanta Housing, learned how to take advantage of the program. It was woven into many of the policy and the segregation that you saw, particularly in the city of Atlanta. It definitely was about creating and controlling, at least from my perspective, populations that were poor. But it was also an opportunity in later years to rebuild the city. And they created the Urban Renewal Program, which is kind of an adjunct to the public housing program. But here in Atlanta, the Urban Renewal Program, as it brought economic development to downtown by basically eradicating large neighborhoods, those families had to be located somewhere. They were predominantly African American. They were predominantly poor. So, for example, the Civic Center was built on a community called Buttermilk Bottom, which, did have some physical challenges. It didn't have sewers. It had issues. But again, by all accounts, it was an active and thriving community with schools and churches and retail, and, sounded like kind of an interesting place to be. And when they determined to put the Civic Center there, because it was, probably easier to attract funding to do something like that than to actually go in and build the infrastructure around, the Buttermilk Bottom neighborhood, those residents were located, and in fact, Bowen Homes, which is one of those West Side developments that was discussed, they were relocated to Bowen Homes, many of them. And so, you have this kind of cycle of moving folks around the city to, achieve certain economic values, and, but also always this idea of racial, keeping a racial balance inside of the city of Atlanta. Somewhere in, I believe, the late 70s, Edward Brooke, a senator out of Massachusetts, they introduced some new legislation. So this is where policy began to impact, yet again, Atlanta. And it changed the tenancy of the residents, because they did not have to they did not have to work any longer. So you had residents who could pay zero rent, and eventually the properties just kind of turned around. And HUD hadn't thought this through because they didn't now have, since people weren't paying rent, there was no money coming in and they couldn't cover the operations. And so then the properties began to deteriorate because they couldn't cover operations. And so you went through a long period where HUD kind of doled out grants as they got money from Congress to help housing authorities across the country apply for grants. And, you could fix kitchens and you could fix doors and certain things that were allowable, but you couldn't really redevelop the entire property. And part of that was because there was a 1-for-1 replacement requirement, and the funding wasn't there to be able to do that. So there was whereas in the 30s when the plan was developed, there was a financing mechanism to build the affordable housing. All of that kind of didn't exist anymore and wasn't supported at the national level. And it's important that these kind of affordable housing programs be supported at the national level. Local communities cannot do it alone. The need is too great. And so, with that, communities were deteriorating. The rents couldn't cover all of the operations. And so committees formed in Atlanta, and our executive director at the time, later President and CEO Renee Glover, was part of that, and built the foundation, along with the Millennial Committee, looking at severely distressed public housing, to figure out how can we finance this? What can we do? People cannot live in these conditions. It isn't right. And so they eventually developed a way to finance through public-private partnerships, being able to put together deals where you could have a public housing unit right next to a market rate unit. And nobody ever thought that would even work. I mean, they thought the market would fall apart if you did that. And they proved them wrong, but it was a complex financial and legal framework that was formed, and that was called the Atlanta model. I remember the first closing for Techwood was actually also the first revitalization under the mixed income model through a program called Hope 6. And there was a table almost 30 feet long filled with lawyers, various manuals. I mean, it's probably about 40 or 50 binders of agreements. Now we can, I wouldn't say we can do it over the phone. There's a lot to be done, but, you're probably down to 2 or 3 binders, and, it's a much simpler mechanism as long as you have financing available. So, that was there was Atlanta leading the forefront again on how to bring capital back into public housing. Now, that was not without controversy because, the premise of this was that you tore down the existing communities, which, had become the neighborhoods around them had in many ways become disinvested. There was not enough money to rehab them, and so many people were relocated. And there's certainly many schools of thought about whether that was positive or negative, but there were existing communities in those neighborhoods, and folks were relocated. And here at Atlanta, the residents still at many of these large sites come together every year. That's how tight and important their community was to them. And so that the Atlanta model became the model that was adopted by HUD across the country, and a lot of public housing was torn down, people were relocated, and new developments were built. Again, it became an economic generator in the communities. And, that is the predominant model today, but it's very dependent on certain sources of revenue, such as tax credits from the federal government that flow through the state, as well as certain affordable housing financial investors. So we're trying to build on a new model now with our new leadership with Eugene Jones, sort of taking that and building, not just rebuilding the public housing, but looking at, so what are the equitable solutions in a community? If you look at a Bowen Homes, for example, and you redevelop it, I mean, you have folks who are relocated from one public housing site to a newly created suburban public housing site, and then you have a neighborhood that when that community was torn down, you have a neighborhood that became really disinvested because all of the users of the goods and services and retail along the major corridors went away. And so, it became its own form of blight. And so what we're really trying to do now is think comprehensively, not only about how we do our sites, but how those sites can impact the surrounding neighborhood, and bringing the neighborhood in through a community engagement process. So we're working on one right now at Bowen, for example, where it's a 74-acre site, so it's huge. But we are engaging the neighborhood. We are engaging the former residents of Bowen to not only get their feedback, but to make sure that they shape and let us see what they would be interested in coming back to. And we're working through Invest Atlanta and partnerships with the city. We're working with the merchants along Donald Lee Hollowell to help make sure that can be a corridor of investment. We're working with Atlanta Public Schools. We're working with a number of providers. And so we're building on sort of these earlier foundations, but now we're going beyond it to recognize that public housing has an impact on the city for one way or another. And so we want to make sure that we're part of that positive conversation.
This is really important information, and I really appreciate you expounding. And it was really important for you to shed that light on Atlanta Housing's role as a leader in the space, and how the agency is actually working to affect positive change through a new model of creating equitable and comprehensive solutions. So thank you so much for sharing that. So now we're going to transition over to Courtney to talk a bit about the future. Let's hop right into it. Tell us what does equitable, affordable housing look like for the future? What are some of these solutions that we need to start trying to forge?
Oh, thank you so much. I'm so excited to be here. This is such an important conversation, and I'm definitely looking to, kind of discussing more with my fellow panelists. This presentation will really focus on couching all these housing issues, all these housing inequities in the framework of healthcare and public health, and understanding that this is an issue that really needs an interdisciplinary approach. It's so complex because of all the layers that my colleagues discussed. All of the issues with respect to racism that are really entrenched in our system can't be solved just by a housing perspective. So understanding how we can achieve, beyond just fair housing, but really true equity, looking at how we can eradicate health disparities that are caused by all of these housing issues and vice versa, will really be a path forward. When we think about these housing and health disparities, just understanding that housing has so many implications for people's health, and this is physical health and mental health, the stress of moving, the tie of housing to education, and how that can contribute to generational poverty, the connection between health and lead poisoning and asthma, all of these medical legal partnerships that have been created to address these health disparities are still not able to reach some more systemic issues, such as the criminal justice system, and how difficult it is for people who are re-entering society to find housing if they're able to do that. So we see it's a really layered issue that we really need to address. So we'll take a look at what the government can do at the local, state, and federal level to try to understand how some of these issues can be resolved and what we can all do to participate in this advocacy. So you can see, I'm sure you maybe have seen this map. If you haven't, it shouldn't be any new information, but this just shows how many hours per week you must work in order to afford fair housing in this country. So you can see that if you take working at the minimum wage for 40 hours per week, you can count literally where fair housing is available. And it's not that widely available in very many countries, and certainly nowhere in the Southeast. So you have to work up to, 80 hours a week, kind of at a minimum in major metropolitan areas to afford fair housing at minimum wage. So if we look at the lifestyle and the health stressors this causes, we're talking about people who might have to work 2 jobs if you're a single parent. And also, this doesn't really describe the type of housing they're even able to afford. So it's not like they'll be homeowners at the end of this period. We might be talking about people who are sharing rooms, people who are, doubled up. And so it's a definite crisis with respect to housing affordability. When we talk about affordable housing, also, we mean generally you're not spending more than 30% of your household income on housing, which is a general marker that all of us tend to use. Even this measure of affordable housing has so many disparities and problems built into it. 30% of someone's income who's making $150,000 a year, you still have plenty of money left over for emergencies, for savings. When you're looking at a family making the minimum wage at less than $30,000 a year, and you're taking a third of that for housing, we see a lot of disparities, putting people in emergent situations and not being able to save and plan for the future. So this measure, even in and of itself, as a benchmark, has a lot of problems, I think. Nonetheless, we're still not able to provide affordable housing for the people who need it, even using this problematic marker. So we look to low-income housing tax credit programs, which has been mentioned, as the number one way to provide affordable housing. And that's funding at the federal level that moves to states and ultimately localities to create housing that's affordable for at least 30 years. And this is rental housing. And then, of course, as was just mentioned, we have the Housing Choice Voucher Program, which allows, in light of public housing rather than public housing, providing families with additional stipends so that they may find rental housing that is affordable. There's not enough funding for these programs. Housing Choice Voucher programs, we'll talk a little bit about how that can be reformed to be more equitable and to not continue to concentrate poverty, which was in part, as Ms. O'Connell was just saying, why we don't have public housing, because we don't want these large structures that concentrate housing, that provide housing only in low-income, heavily minority populations. We want more integrated housing patterns pursuant to the Fair Housing Act, but we're not able to achieve that if we don't have equity within the Housing Choice Voucher system. And when we take a look at what housing can do with respect to health equity and how these health disparities affect housing, we really want to understand what health disparities are and what health equity is. If we are looking at a definition of what health disparities are and how we want to create health equity, we're looking at these preventable differences in the burden of disease and opportunities to achieve optimal health experiences by socially disadvantaged populations. These are most often low-income populations, communities of color, and the key to this, especially when we're looking at this from a race perspective, is that these are preventable differences. So these are not differences that are baked in someone's genetic code. These are social issues, employment, housing, employment opportunities with respect to education that can all be prevented if we had a more equitable society. So just looking at this from a disparate impact perspective, low-income individuals have disproportionately high rates of obesity, asthma, and other illnesses. This is truly just attributable to the fact of what their income level is, and the fact that we have socioeconomic differences accounting for people living longer, for people dying earlier, for people experiencing these chronic diseases truly does not reflect well on our policies. And if we look at this from a racial perspective, looking at the white and African American infant mortality rates, it's greater today than it was in 1950. There's no reason for African American infants, African American mothers to have these poor experiences during childbirth when we're controlling for all other factors, including income and healthcare and access to healthcare. So what can we do to address these differences? It goes beyond just housing. We really have to look at some of the underlying economic and social issues. One thing that I like to keep in mind that Professor Scott Burris really emphasizes is that there's two important ways from a legal perspective, how can the law interact with these social determinants of health, such as education, housing, employment, criminal justice, incarceration records, voting rights. How can the law interact with these things? The law can be helpful. It can help to structure and perpetuate the social conditions that we describe as social determinants. And it acts as a mechanism or mediator through which social structures are transformed into levels and distributions of health. So if these social determinants that we want are positive, the law can really perpetuate change and make us progress forward. If we're just reinforcing these same racist social determinants that are part of the system that we were founded upon, then we're just making things worse. And the law is truly an obstacle and not a solution. So we really have to focus on how the law can really act as a transformational vessel if we want to focus on population and individual health through housing. So just some of the ways we can think about our reform from a funding and resource perspective, really having transparency in the funds and the allocation process. Who are we giving these tax credits to? It's a competitive program. What are we valuing? Whose input are we taking into account when we structure the application process for these tax credit programs? And are we holding private developers accountable for doing what they said they would do in their application? What do we need to change? And how do we need to follow up to make sure that the residents have a voice in this process? When we look at local vouchers to supplement a federal program, what are localities able to do to contribute so that they can provide funding so that their members are able to have a voice, and we can make it a more community-centered process when we're looking to add more affordable housing? And we need more units. We don't have enough affordable housing, so what are we doing to develop new affordable housing? And are we listening to organizations who are on the ground, such as Atlanta Housing, all of these organizations who are aware of the need and who have targeted land that can be developed for affordable housing? Preserving subsidized affordable housing is very important, especially in large metropolitan areas. If you take a look at Atlanta, historically, we see a lot of patterns of gentrification and low-income individuals being displaced. So what are we doing to ensure that as we have more equitable development, as businesses are moving into the city, that these original residents are able to stay in their home? What are we doing for them from a tax perspective, home ownership plans, providing assistance for down payments? All of these things will help. And also looking at land trusts to acquire vacant property as another mechanism for long-term affordability. So these are just some ideas from a funding and resource perspective that will help us move forward to achieve health equity through housing. And also looking at citywide inclusionary zoning covering townhomes and condos. So we want for zoning to be inclusive. We don't want to just have a way to get around segregation laws by creating zoning laws that keep people separated. We don't want to have zoning laws that prohibit multifamily units in certain neighborhoods. We need to look also at what we can do to promote acceptance of housing choice vouchers. Is there a source of income protection? Are we letting landlords discriminate on who they will allow to rent their units based on if they have housing choice vouchers? And what can we do to address that? Another way to advocate for tenants is to provide any type of legal assistance. The eviction court process, the dispossessory process can be very difficult to navigate. It can be very costly. It can be really an obstacle to people, especially given the fact that you often have to leave your job to advocate for yourself in court. So you have to decide whether or not I want to work today or I want to go fight for my right to not be evicted. And that's a horrible choice to make, especially if no one's there to help you navigate the system. So what type of legal aid funds are available for tenants, and what type of advocacy are we providing? All of these things for equitable development would be very helpful, not just for housing, but for all of these other systems. And taking into account what can we do at these other systems that would likewise affect housing. That's something to really keep in mind. So from a criminal justice perspective, what are we doing to expunge arrest and conviction records so that we're not preventing people from having access to social services? So we're not disqualifying people unnecessarily from the housing choice voucher program or from other social services that would allow them to get a job, to be gainfully employed? What are we doing to prevent people from discriminating against people from having criminal records, or reducing businesses' liability so that they're able to employ people with a criminal record to create a higher income so that housing is more affordable? From an education system, is our reliance on property tax going to create a two-tier system where people who live in neighborhoods with higher property taxes are then able to go to better public schools? If so, how can we have a more equitable distribution so that education is not just equal, but accounts for all of the issues that people of low income, people of color might have experienced? They might need additional educational resources. They might not have access to college planning, career counseling, or even an arts program in their school. So what can we do to create a more equitable education program? And from a healthcare perspective, there are medical legal partnerships, but we can definitely expand upon that. So we know that if you're living in substandard housing that has allowing you to have experience all of these physical health impacts, and you go see a doctor, the doctor treats your asthma, you go back to your home that might have mold and allergens, we're not really solving the problem. So how is the medical community working with law clinics, working with attorneys to really address this holistically? If we're not expanding Medicaid in a certain state, if we're not focused on providing access to healthcare, how might that affect any type of housing policy? You know, understanding the need to provide an access to healthcare, it should be considered a housing policy just as much as housing policies should be considered healthcare policies. And overall in the healthcare system, if people are reticent to seek medical help, how are we going to understand how their housing might be detrimental to their healthcare? So what are we doing to expand diversity within the healthcare system to foster good physician and patient relationships? So looking at this from an infrastructure perspective, not just from housing, but from all of these other systems, and really building upon our system that we have in place to understand how equity can be achieved will really help to have housing and health in all policies. Thank you all very much for your time, and I definitely look forward to continuing the conversation.